When you're ready.
Stem cell therapies. Our investigative questions are stem cell therapies effective? We are going to be exploring this through the scientific, economic, and futuristic perspectives.
And based on our evidence, our group has concluded that yes, stem cell therapies are effective. First, we're going to be viewing this from the scientific lens.
The success rate of stem cells is 80%, and only continuing to go up from there. There have now been over 1 million transplants performed, and using regenerative medicine, it allows us to find treatments to fatal diseases such as cancer, Alzheimer's, Parkinson's, and many other diseases known to have no cure. It also helps us understand these diseases and the factors leading up to why they occur. A quote from the Mayo Clinic states how stem cells have already been used to treat many diseases. Doctors have performed stem cell transplants, also known as bone marrow transplants, and stem cell transplants. Stem cells were replaced by damaged by chemotherapy or disease, or serve as a way for donors' immune systems to fight some diseases of cancer and blood-related diseases such as leukemia, lymphoma, neuroblastoma, and multiple myeloma. Stem cells also allow for tissue to be repaired and replaced when damaged or injured. They also prevent nerve damage and allow tissue to grow. These treatments limit complications and push for a healthier way of life post-surgery and shorter recovery time. It limits complications such as pain, inflammation, and rejection. Reduced rejection is important because it's something many patients suffer with post-surgery if not using stem cells. Although they are effective, there are some limitations. These treatments can cause something called tumorigenesis, which is certain scenarios that can cause tumors. They can emerge due to incorrect patterning, reprogramming factors, or genetic mutations. Incorrect patterning, also known as teratomas, can be prevented due to successful methods of test tube differentiation, purifying cells using antibodies, and mismatching alleles. Tumors caused by reprogramming factors can try to be prevented by avoiding use of CMYC. Tumors caused by genetic mutations can cause chromosome abnormalities, which subsequently can prevent the risk of. Other genetic abnormalities can be prevented by generation sequencing. Next, we'll look at this through the economic lens.
The demand for stem cell therapies has increased over the past decade. With new marketing strategies and social media, the topic of regenerative therapies has become widespread. Along with high demand, stem cell trials also need sufficient funding to succeed. 70% are funded by academic institutions, while 30% are funded by private companies. The growing pool of consumers and funders is crucial in ensuring that these therapies will continue to grow and progress. Because of the favorable results, there is exponential growth in new therapies. The previously small world of stem cell research has evolved into areas of pharmacological testing, alternatives for arthroplasty, and fertility remedies. Lastly, the best example of large revenue is a quote by Goldman stating, California's $3 billion investment into the California Institute for Regenerative Medicine in 2004 has resulted in over 56,000 jobs created and added approximately $10 billion to the state's economy. This direct correlation proves that regeneration therapies creates jobs and money. Creating high-paying, stable jobs with livable wages is crucial in ensuring that these therapies will continue to progress. Funding is clearly profitable, but it also advances scientific progress in diseases previously thought as incurable, potentially saving many lives. While there are many successes, there are also some limitations. One of these includes illegitimate therapies marketed. Businesses are marketing illegitimate therapies, which creates hesitation within consumers. Anti-aging, diabetes, and orthopedic injuries are all targeted therapies to market, and most do not have sufficient evidence to back up claims made by corporations. While these marketing schemes are highly illegal, they are also very dangerous for those participating in these trials. These concerns are valid, but the growth of new trials continues to persist amongst adversity. Next, we're going to be exploring this through the futuristic lens. The growth of stem cell research has increased so much, which is shown off from a quote from researchers at the University of Edinburgh. Stem cell research has grown twice as fast, 7%, as the world's average growth in research, which is 2.9%. This rate of growth shows how much future potential stem cell therapies really have. In particular, one research study that has hope for future success is regenerative medicine. This includes being able to treat degenerative diseases and being able to regenerate damaged organs. This can bring a whole new level of treatments to doctors and patients. Another persistent problem in the world is diseases that are incurable. Researchers are constantly looking for a cure for these, especially immune disorders and cardiovascular diseases. Stem cells are being studied to be used as a cure for these and hopefully bring some relief to those suffering with these diseases. Both of these research topics have had numerous trials and successes and have a future of their own. With these successes, there are some limitations.